my name's Thomina. I'm one of the social workers at the Princess Alexandra Hospital in Brisbane, and I'm part of the Transplant and Renal unit here. This is my colleague Cathy Martin.
Hello everybody.
We've been invited by Transplant Australia just to have a quick chat with you about ways to keep socially connected and active, as well as maintaining your health and well-being during this time. We've just got 3 tips that we'd like to share with you, and feel free to share yours with us as time goes on. The first tip that we'd like to share is about staying connected with your local service and health providers. This includes your GP, your renal and transplant units in your hometown. They're full of great resources and staff who are able to point you in the right direction of ways to keep yourself well and connected. Social workers are always at your service through your home hospital, and all you have to do is ask for a referral.
So that leads us on to really tip 2. You heard Thomina mention about the social workers, and we're all contactable by phone, and we can also have appointments with patients in the outpatient setting and when they come in as inpatients. But we're finding that phone is fantastic. That leads us to this tip 2, which is to do with internet support. You'd all be very connected, I'm sure, with the internet. Most of you have got smartphones. A lot of you are on your devices when you're waiting in to see the doctors and so forth. But what we're finding is that there's a lot of fantastic websites out there, to the point where sometimes people say to us, which are the best ones to use? Well, there are so many of them. We are now recommending that people start with a website called Head to Health. So if you don't remember any other words from today, just Google the words Head to Health, as that will link you to heaps of fantastic resources Australia-wide. So whether you live in Western Australia, whether you're South Australia, Queensland, all the information is there. It's fabulous. This site will link you to organisations many of you have heard of, such as Beyond Blue, the Lifeline Support Services, mental health services, aged services, anything that you can think of, or anything you're not even so sure exists, you'll find it on Head to Health. So that is probably our strongest recommendation, that in addition to perhaps looking at your own local health service websites to do with your own hospitals, go to Head to Health and you'll find everything that you should need at this starting point. So that'd be the second tip. What do you think could be the main third tip, Thomina?
Our third tip really is around staying, as I said, socially active and connected within your own communities. This could be as easy as picking up the phone and calling a friend, a relative that you maybe not spoken to in a while. We always say we don't have the time. Time is now on our hands. It's also about looking into your community and what resources they've started to build. Things like your local library will have an online presence, looking at audio books, things that you can do around the home, but also ways to stay connected to your community. It might be through volunteer services that you might like to volunteer with, or receive the services that the volunteers are offering, and just getting out and staying active, whether it just be going for a walk around the backyard or down the street, talking to a neighbour over the fence, or even starting something that you thought you'd never ever do. Maybe it might be painting, it might be yoga, it might be something that you thought, I'd like to do that, but I don't have the time or I don't have the resources. We all have the time and resources now, and we as a hospital service and your local hospital service have those resources to talk to you about. You're in control here. You have the resources at your fingertips through your local hospital and health service, and we as social workers, a part of that, really want to help you find what will work best for you during this time.
That's true. And Thomina, if I could just add something else, a number of patients have been very financially challenged during this time, and so we are definitely recommending that people make direct contact with the Centrelink websites, and also organisations such as the National Debt Helpline. That's another fantastic set of words to Google, National Debt Helpline, and they can most certainly talk with you about any issues that you're having with payment of bills. They can support you with deferment of monies. They can make sure that any house and rental situations can be dealt with as quickly and as comfortably and discreetly as possible. So it's very important to know that there's a lot of support services out there. But as Thomina said, we can put ourselves in the driver's seat here. Everyone has a choice as to whether we want to manage this in a way where we are worried about it, or whether we try and just keep on top of things as best as what we possibly can. So with all of that, we ultimately would say do what works. If something's working really well for you, keep on doing it. If you think about something and you're thinking, well, hey, I used to be quite good at doing a certain thing, but I haven't done this for quite some time and I'm going to use this time really well, then why not? Look at learning how to redo things. Go out and do some walking, do your exercise, do your activities. That's what it's all about. It's about trying to look after yourself, keep well, keep in touch with people, and keep in touch with us. So, on that note, is there anything else, Thomina, we ought add, or do you think we've covered what we need to?
I think just wish everyone the very best of luck, and know that you're part of a really big community here, and we're all here to support one another. All you have to do is reach out. You're in the driving seat and you've got our phone numbers. Please get in contact when you need us.